Good morning. Myself Ravina Kalyan, Assistant Professor, Faculty in Applied Health Science in RPIIT Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So today we'll talk about the types of fracture. That is the classification of fracture. First is definition of fracture. A fracture is a break in the continuity of a bone. It can be partial or it can be complete. So it can be classified on the basis of etiology or also known as causes. Second classification is based on the relationship of the fracture with the external environment. And third classification is based on the displacement of the fracture. And the last classification is based on the pattern of the fracture. So first classification, which is on the basis of etiology. According to this, fractures are classified into three types. First is traumatic fracture, second is pathological fracture, third is stress fracture. So first, traumatic fracture, which is mainly occur due to any injury. So a fracture sustained due to trauma is called traumatic fracture. For example, fracture caused by a fall, road traffic accident, fight, etc. Second type of fracture in this classification is pathological fracture. Pathological fracture mainly occur due to some disease in which bone become weak. So a fracture through a bone which has been made weak by some underlying disease is called pathological fracture. For example, fracture through a bone weakened by metastasis, also known as cancer. Third fracture is stress fracture, which are mainly caused by the overuse injury, and it is most common fracture seen in the sports players. So this is a type of fracture sustained due to chronic repetitive injury or stress caused a break in bony tubercle. This is often present as only pain and may not be visible on X-rays. Next classification is on the basis of displacement, in which fractures are classified into two parts: undisplaced fracture and displaced fracture. In undisplaced fractures the fractures are easy to identify by the absence of significant displacement. Mainly in undisplacement fracture जो bone alignment होता है वो disturb नहीं होता. So next fracture is displaced fracture. A fracture may be displaced और it is also और displaced fracture में जो bone alignment होता है वो disturb हो जाता है. डिस्प्लेसमेंट के जो मेन रिस्पॉन्सिबल जो फैक्टर्स है वो है फर्स्ट फ्रैक्चरिंग फोर्स, सेकंड मसल पुल ऑफ द फ्रैक्चर फ्रैगमेंट्स एंड थर्ड इज ग्रेविटी. नेक्स्ट क्लासिफिकेशन इज ऑन द बेसिस ऑफ रिलेशनशिप विद एक्सटर्नल एनवायरनमेंट. According to this classification, fractures are classified into closed fracture and open fracture. Closed fracture is a fracture not communicating with the external environment, that is the overlying skin and other soft tissues are intact, is called closed fracture. And the open fracture is a fracture with break in the overlying skin and soft tissues leading to fracture communicating with external environment is called open fracture. And open fracture is further classified into two parts: internally open and externally open. Internally open means from within. The sharp fracture and pierces the skin from within, resulting in an open fracture. And externally open means open from outside. The object causing the fracture lacerates the skin and soft tissue over the bone as it breaks the bone, resulting in an open fracture. Next classification is based on the complexity of treatment, which means that the fracture is very simple or complex. So on this basis, fractures are classified into two parts: simple fracture and complex fracture. Simple fracture, a fracture in two pieces, usually easy to treat, is called simple fracture. For example, transverse fracture of humerus. The most commonly simple fractures are hairline fractures. Next is complex fracture, a fracture in multiple pieces. When bone is break into many fragments, those fracture is known as complex fractures. For example, comminuted fracture of tibia. And also in complex fracture, displaced fractures are commonly occurred. So on the basis, next classification of fracture is based on the pattern. So in this diagram, type of fractures are shown. In first is transverse fracture, a straight line fracture होगा. Second is oblique fracture. Third is spiral fracture. In spiral fracture, the bone fragments move in opposite direction. Next is comminuted fracture, when bone break in many fragments. Next is segmental fractures. So first, transverse fracture. In this fracture, the fracture line is perpendicular to the long axis of the bone. Such a fracture is caused by tapping or bending force. Second is oblique fracture. In this fracture, the fracture line is oblique. Such fracture is caused by a bending force. Next is spiral fracture. In this fracture, the fracture lines run spirally in more than one plane. Such a fracture is caused by primarily twisted force. Next is comminuted fractures. So this is fracture with multiple fragments. It is caused by crushing or compression force along the long axis of the bone. Next is segmental fracture. In this type, there are two fractures in one bone but at different level. For example, it may be comminuted but primarily are transverse fractures. Thank you.